I am Danielle Liss, 42, from Northwest Indiana. I have been with my husband for 17 years, and I have 3 beautiful children. I decided back in December first let me thank you for letting me tell my story. I think it's important to hear other patients' stories of how they got through this procedure, because going into it, I was definitely one of those very scared patients. I decided to go in for elective tubal ligation surgery back in December. I have to thank my husband for not making the appointment that he was supposed to make, because that's when my cancer was found. I basically went in, and the doctor came out and said everything went well, but he showed us some pictures of some material that he found on my ovaries, and he was clueless, had no idea what it was. Told us that he was going to find out what it was, though. And, looking back now at the work he put into trying to find a diagnosis for me is remarkable, because back in my area where I live, all the doctors and surgeons had only read about it. They never knew what it was. I actually was diagnosed with low-grade mucinous neoplasm of the appendix / pseudomyxoma peritonei. This all started with my outpatient surgery. The doctor ordered my CAT scan. He found out what blood tests he needed to order. This is all not knowing anything about this disease. He sent everything to Mayo Clinic and decided he was going to get a second opinion, because talking to other surgeons in the area, nobody really had that particular knowledge to this disease, and he wanted to make sure that it was correctly diagnosed. Went into his office on December 12th, and he told me what it was. He also said that he knew of the HIPEC procedure, but he didn't really know where to start. He was going to talk to some other surgeons in the area and see if they could at least lead me to the direction of finding someone that could treat this. So our search started. We right away got referred to an in-state doctor, a doctor in Indiana. And that surgeon, although knowledgeable with the disease and also did the HIPEC surgery, referred me more to do a debulking surgery. Did not want to do the HIPEC, said that even though they did the HIPEC, it was not beneficial to someone at my stage, which kind of, we left there with mixed emotions, because then what it ends up being, and the surgeon explained this, it ends up being every couple of years you could go in and have to get tuned up, and I didn't want to be tuned up. I was very scared of that. So we left there, and we decided we need to do some more research, and my husband took it upon himself to be my medical consultant. He sent all my records and PDF file to different surgeons all over the United States. We actually had 4 different consultants. Our first one was a surgeon in California, and it was over the phone. He was very optimistic about how lucky I was to have found it, which I had already understood how lucky I was to have found this. He also said that he would treat me and told me that he would highly recommend the HIPEC procedure. How he would treat me being in Indiana was going to be a little bit different, because I would have to go there a couple of days before, do a lot of tests. It was going to be really hard on my family, having 2 young boys at home. I was scared to go to California, but we would have gone. But he stopped us and asked us why we weren't looking more closer to home. Said that there was a surgeon in the suburbs of Chicago, Dr. Salty, and said how important it was to have a support system close to you when you're going through a procedure like this. I don't know how we missed Dr. Salty. I mean, we didn't somehow missed him, and we immediately found him, and lucky, I don't know how lucky, my husband called January 4th, I remember, and Dr. Salty had a cancellation, told us the nurse said we had 2 hours to get there. So we jumped in the car, and we got there, brought with all records in tow, and to say that Dr. Salty had patience with my repetitive questions over and over is an understatement. I'm known to repeat myself, and this kind of situation, I think anybody in my type of boat understands how those questions, they repeat in your head over and over and over. I don't know if it's that I was looking for some kind of guarantee or what, but when Dr. Salty told me that the same as the surgeon in California, that he would highly recommend the HIPEC, I was a candidate for it. It did look like it was caught early. I mean, we knew that it was pseudomyxoma peritoneae. We did not know exactly everything that was affected, but he seemed very positive and said that he would do the same for his family that he would do for me, and that's how he would take care of me. It seemed like forever I sat in that office and asked him questions, but we left there with a different thought. We left there feeling like, even though we had another consultation scheduled, so that would be our fourth, we had already found our surgeon. My husband called him immediately and told him, and he was actually, I think, the next day you called him, and you actually called on the way home on your cell phone to say you got the message and you wanted to schedule the surgery, and thank you for giving you the opportunity and you would take care of me. And that's all I needed. I needed that comfort. I've joked around about choosing a specialist, which is so important when it comes to something like my disease. If I stayed in state, I would have had a surgery that could have it could have ruined my chances of having a complete cytoreduction in the future. So to take it upon ourselves and be our biggest advocates, to find somebody and to find that surgeon that you feel comfortable with the knowledge and experience and passion as Dr. Salty has, I knew it immediately that that's who was going to do this operation, as scary as it was. I scheduled the surgery a month after we met, and it gave me time. I'm a control freak, anybody that knows me, so I had that time to mentally prepare myself, physically prepare my family, talk to teachers, make lists and menus, and you name it, I did it. But I had a month to do it. So by the time my surgery rolled around, my father decided he was going to come up, and we live in Northwest Indiana, so we had a lot of lake effect snow, and actually it was the worst night of the season. We drove 2 cars to be at the hospital at 5 o'clock in the morning because I was persistent on not spending the night locally because I wanted to do all my prepping and stuff at home. I don't know. I decided that we were going to drive the next day, and I told my father and my husband that no matter what, they had to get me to that hospital. I was ready. I had my gear on, let's go. So they drove 2 cars in case one got stuck, and it took us a while to get there. And the first thing I thought of is, oh, dear Lord, Dr. Salty has to come from Chicago. How's he going to get here? Immediately, every person on that surgical team greeted me, explained what their duties were, what they were going to do for me, what to expect when I woke up. The anesthesiologist told me what tubes and wires and everything he was going to hook me up to. At this point, Dr. Salty walks in, thank God, and says he's here. He grabbed my hand and told me he was going to take care of it and that he read the manual the night before. So I knew we were good to go. I knew we were good at that point. As scared as I was leading up to it and reading so much about this procedure, I felt like it was time. I would not have done well waiting any longer. I wanted to get this out of me. I knew that it could be more successful by doing it sooner than later. I came out. Dr. Salty had explained to my husband and my father how they would give them basically news as I was being operated on, and my husband said they did just that. Someone from the surgical team would call and tell him where he was with the operation and how things were going. And then in between, after the cytoreductive was done and the chemo started, Dr. Salty actually came out and told my husband that it was successful. He felt like he got all the tumors. Said that he got all the tumors and the mucin, and it was a successful surgery, and there was a little bit more than we might have thought, but at the same time it was all taken care of. I woke up in ICU, and that's all I had to hear. I woke up in ICU that night, and I knew exactly what tubes were out of me because of the surgical team. I looked at my husband, and he told me that I was taken care of, and I fell back asleep. That's all I need to hear. But the next day, within 24 hours, let me jump back a little bit. When I found Dr. Salty, I did reach out to a patient and a caregiver of Dr. Salty's, because I thought it was important to not only learn more about the surgery, but also speak with someone that has personal relationships with Dr. Salty, and one of them being Therese. And I will tell you that without her and the other patient, I don't know how I could have gotten through it. So I thank you for that. They told me what to expect, what to do, what to bring to the hospital, what to do after the surgery, and all that I had in my head was walk, 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 and walk. So after the surgery, waking up in ICU 24 hours later, they wanted to get me up and walk, and I knew I had to get up and walk. So they told me to walk to the door. I walked to the door, and then I just kept walking, and I walked down the hall, and they were kind of shocked by that, but I knew at that point I had battle beast mode on. I knew that I was in full gear. I had to get better and get home, and I also knew that it was going to make my recovery better, and it was going to help, any risks that were involved with the surgery alone. Then I got transferred to floor 7, CTU. And to say that those nurses on that floor are wonderful and exceptional is an understatement. That team that Dr. Salty has molded to take care of his patients were not only caring and very educated on what to do with my type of situation. They were also very passionate about taking care of my type of situation. That's where I got to meet some of the most wonderful people I've ever met. Nurse Kathy actually took very good care of me. I felt like a family member of hers, and it made my stay at the hospital a lot easier, knowing that someone was not only taking care of me, but cheerleading me on and helping me all the way. So I thank you for that. I can tell you one of the biggest things about being at Edward in general was I could have a family member with me 24 hours a day. They could sleep on that nice little couch right next to me, which I guess isn't that comfortable, but to have that security of someone beside me when I had to get up and try to wrestle to the restroom, or just, there's those times that you just don't always want to call the nurse button. And to have my husband and my sister and my best friend who took turns be there for me, I've heard of situations where the other hospitals don't allow that, and I just couldn't imagine to not have that support right by my side. I have to say that in the hospital after the surgery, a lot of things were done. I'm not going to get too technical because anybody that's had the HIPAC knows a lot of things are done. The pain management was great. Looking back, I can't even remember being in too much pain. Uncomfortable, awkward, yes. But that was more rolling out of bed and trying to go to the bathroom and things like that. Having 60 staples obviously is going to pose a little bit of a problem. But as for the pain management, I just can't even tell you that I could argue that. I will argue with that NG tube, though. That was my nemesis. I told everyone that walked in the room, the nurses can vouch for me, that thing had to get out, and it took 6 days to get out, and we had a small celebration when it did. We took selfies before and selfies after. We were so excited. When it comes to across the floor, just how important it is to have nursing staff, and Dr. Salty and Gina, who, thank God for her, come in and be there every day to answer questions and check on me and make sure that everything was going the way that he wanted it to go, because he is a perfectionist, was so inspiring to me that I knew that I was in the best care, and I knew that no matter what my body had just been through, that no matter what, they were going to make sure that I was in the best care. a nutritionist came in, not you, but someone else, came in several times and talked about how important it was for protein and healing, and I took that home with me. You can ask my best friend who took care of me for 2 weeks. Everything was about protein, so I do believe in that. I will tell you, when I left, I was scared. Gina was very realistic with me about it was going to be hard and I was going to have challenges, but she allows me 15 minutes a day to cry and scream and do whatever I had to do once I went home, and then just put it away. And to this day, I still use that 15 minutes and I put it away. I can tell you that it was a lot harder when I went home than I was in the hospital because I didn't have that care all the time. Even though I did have most wonderful caregivers, my in-laws, my best friend, my family, helping me emotionally, I was, up and down. But I used my 15 minutes, I put it away, and I got on the treadmill. And that's what I did at the hospital. I walked and walked and walked. And I would guess anybody on floor 7 would tell you that that's how I feel was so important to my recovery and getting out of the hospital. I went back to work at 5 weeks, and I even started going to like a physical trainer after 8 weeks. Small, but just made me feel better. I felt like it helped my stamina, it helped me mentally. I decided that this wasn't going to hold me down. As big and scary and everything that I was minus now, I really felt like this was a new beginning for me. I felt like the surgery itself being offered to a patient like myself, if you look back in studies, which I don't know how to decipher a lot of them, but thank God it's here. Thank God we have the HIAPEC. When it comes to finding a specialist, so I do see so many people that just get treated close to home, and they get treated with that doctor that doesn't really know that much. I do hope that more surgeons and more hospitals learn about this procedure so that it is offered to more patients. But if I have to keep traveling to Dr. Salty every 3 months for the next how many years, that's what I'm going to do, because he knows what he's doing, and that makes me feel better. When it comes to, in conclusion, what I've taken from this experience is how important caregivers are. I've worried about my husband at times being there to emotionally lift me up and make sure that I'm physically okay. And I'm so important that the teams talked about how important they take care of their caregivers also. I think that a lot of the times they worry so much about the other person, they don't take care of themselves. And I think that that's really important, that there is means to take care of them also. Choosing the right doctor, I've already talked about. The team itself taking care of you after surgery. I could have called Dr. Salty or Gina or Danielle or even Therese any time and gotten the answer that I needed when it came to questions that might have been going on with my belly or anything, and to know that at any time, I not only have a surgical team, I have friends that I found during this process. I have to tell you, the biggest thing that's got me through this is my positive attitude. I don't want to toot my own horn, but I've decided after being diagnosed with this that nobody's immune to cancer. I was that one that thought that I couldn't get cancer. It wasn't me. I lived a good life. I was, there was no way that was going to happen to me. So to say that when I was diagnosed with no symptoms out of the blue, it did take me down. But after I had the opportunity to have that removed and go through this procedure, I've decided to live my life a little bit different and live it more on a day-to-day basis, making sure that every second counts. I think that before my diagnosis, I would never have come up here and spoken to you guys all today, especially about myself. I did tell Nurse Kathy when I was being taken care of that I wanted to speak with other patients and I wanted to help other patients advocate. I didn't really know how to start doing this, so when Gina and Dr. Salty and everyone asked if I would do this, I knew this was a beginning. As scared as I was, I've already spoken to a few patients that have seen him since February. I'm only 8 months out, just so you guys know. I have spoken to a few other patients, and it's amazing how supportive PMP patients are of one another. And I tend to go more for the positive because that's how I deal with it. But I will tell you that in a therapeutic way, speaking with you guys today, it's really helped me. And I thank you guys so much for letting me tell you my story.